In the studio today with Dr. Greg Johnson, Regional Market President at Parkview Health, located in Fort Wayne, Indiana, with campuses throughout the state of Indiana and Ohio, serving communities large and small. It's great to have him in the studio for our podcast, but also for our news bit today, Rural Health Today. We're going to talk to him a little bit about one question, and that question is, what management and leadership skills do you feel are most important for a rural health leader today?
So I would say probably the most important thing would be to make sure that your existing leaders are developing new leaders. And, if there is a difference between rural health and urban health, I don't know if that's even a word,
Sure.
Is that there's a lot more people.
Yeah.
Right. So it's even more.
Bench strength's a little bit better.
Yeah.
Right?
So I wouldn't say it is better. It's deeper.
Deeper. There we go. I like that.
And I would say that we need to spend more time developing our leaders.
Yeah.
And we often think physicians are leaders. And not always. They're content experts. They're professionals.
Sure.
It's incredible what we can do as a profession.
Yeah.
But we need to develop, even within our own physicians, those physician leaders. Because leadership skills is different than taking care of someone, putting together a care plan, helping a patient execute a care plan.
Mm-hmm.
So I would say developing leaders is one of the most important.
So, Dr. Johnson, when you say developing the leader, I would think that goes across all levels of hospital, right? Not just talking about the rural hospital, but also the urban hospital. Develop. How does one best develop a leader? So if someone's listening today saying, where do I start? Is it a program? Is it a conversation? Is it an algorithm? What is it?
So the first is intentionality. The second is people see what you do more than what you say.
Yeah.
So intentionality, and people will follow leaders, generally speaking, naturally. What I would say in the rural health setting is often you get a leader who is exceptionally strong, and they'll be there for 10 years, 20 years, 30 years, right? and then there's a void.
There is.
And so that's what I mean about that intentionality of developing leaders. And there's different, not all leaders are created equal.
Mm-hmm.
We all have different strengths and weaknesses. The key is to lean on the strengths and shore up the opportunities or the weaknesses, and helping somebody with that, because most of the times our opportunities, and I don't like use the term weaknesses because they are just opportunities. Most of the time it's related to a lack of self-awareness, and that's what really mentorship is. It's to help somebody see the blind spot that they have. And as our pastor said this last week, is if he was talking about blind spots, and if you say, well, I know people who got a lot of blind spots, I don't have any. There's a first blind spot to work on.
You heard it here from the industry expert, Dr. Greg Johnson, and I truly say that with all sincerity. He's done a phenomenal job as a regional market president, but before that, provider, still physician, but now transitioning into really leading a very big system and charting new territories and new pathways that help rural hospitals just like Hillsdale. So thanks for joining us today. It's been great to have you.
Thank you.